understanding the importance of heart health. Please help me welcome very smart man, Dr. Patrick Rudersdorf. Is that right?
Yes.
Oh, that's very good. Cardiothoracic surgeon for the CommonSpirit Health. You're very great with these heart socks that your wife made you wear. Very cute.
Yes,
very
thank
cute.
you.
So let's talk to you about this. How have minimally invasive cardiovascular techniques evolved over the years?
Great question.
Thank you.
Minimally invasive techniques have evolved to the point where we can now do a lot of valve surgeries percutaneously.
What does that mean?
Without opening someone's chest, either through the sternum in the front or through the side.
Got it.
We can go in through arteries and veins in the groin, as an example, with a small, tiny little incision and fix or repair heart valves that way.
Unbelievable.
And so it's reduced or really eliminated the downtime that patients experience, and more importantly, the recovery.
Right, and any infection that might happen. Let me ask you something. Are there cameras on those that go up, or is it too small?
Well, there's no cameras, but we do it under X-ray or fluoroscopy when we're doing the procedure. And then also sometimes under ultrasound or echocardiography through the mouth.
Oh, wow. Wow, the future is now.
Cool.
The future is now. Okay, a lot of times we hear of people having something called an aortic aneurysm.
Yes.
Sounds real bad because the aorta seems very important. Talk to me about what that is.
Yeah, so this is my particular area of clinical interest and passion. And it is a challenge because it is not symptomatic, meaning patients don't experience any chest discomfort or any sort of symptoms until it can become potentially life-threatening.
Oh, wow.
And so typically an aneurysm, whether it's in the head, chest, or abdomen, is just an enlarged blood vessel.
Yes,
and so rather than being whatever the diameter is, it has reached a certain size that we worry about it rupturing.
Like bursting. Yes.
Bursting. And that is a catastrophic event. And so we try to intervene on aneurysms, particularly in the chest, after a certain threshold is reached.
I see. How do you find the threshold you can measure?
You can measure it. Usually it's done with CT scan or ultrasound.
Okay,
yes.
okay. So in those cases, how do advances in surgical techniques improve safety and long-term outcomes? Because again, I was asking you before on camera, like you use the retractor, like it used to be really sort of like very intense like that, but it's become
And we still do the traditional open heart surgeries for certain patients. Some patients are candidate for less invasive or minimally invasive approaches. So as an example, endovascular repair. Still same concept, going in through the groin, but now we're putting a stent inside the aorta that's aneurysmal or diseased. And so we're able to treat patients, again, less invasively, and it just allows them to get back to recovery and enjoy on with their life faster.
Of course. My grandfather had a quadruple bypass, and it took a long time. It was very, very scary.
Yep.
Okay, we understand that advanced aortic surgery requires a multidisciplinary, you know what I'm saying?
Disciplinary.
Thank you, team.
Yes.
And I'm thinking of like the pit with everyone from surgery to the cardio. How can you describe how collaborations across specialties improve patient care in complex cases? Having all those people in the room and the teams, how does that work?
It starts from day one, and it starts well before surgery. And I grew up playing sports, and I would jokingly tell my team, this is the best team I've ever been a part of. And it's from the nurses, the therapists, the EVAs people, meaning the individuals that come and sanitize the operating room, the patient's hospital room, the linen people, changing the bed sheets, et cetera. And, specifically those that relates to like doctors and stuff, it's interventional radiologists, individuals that have the expertise to read the CT scan, cardiologists that have the expertise to detect an aneurysm that otherwise is producing no symptoms.
Yeah, that's terrifying.
In a patient, and then all the members of the heart team that are involved in these operations. And so when we're in the operating room, there's at least 8, sometimes up to 12 other individuals doing their own job, helping me do the surgery to get patients through an event in their life that they want to move on from.
Yeah, it's kind of you to mention everyone, including the nurses and the linens. People often don't even include that. I think that's very kind of you.
It's a huge teamwork.
It is, it is. So what should patients know about recovery expectations and more importantly, their quality of life following, let's say, a minimally invasive procedure?
Yeah, whether it's a minimally invasive surgery, whether it's traditional open heart surgery, the whole goal for me and for our team is to get patients back to doing whatever it is that they love to do, whether it's golfing, whether it's skiing, whether it's doing their honey-do list, whatever it is, that's what we want to get them back to do.
Wow. Unbelievable. I bet you see people and they're just like a whole new color and glow to them because they've fixed so much.
Yeah, I have the best job in the world.
I bet you do, yeah. A lot of egos in that room when all those people, doctors and surgeons are together?
No, I think that one of the things really now with modern medicine is this heart team concept.
Oh,
and
nice.
so we really don't practice, doctors really don't practice in silos anymore.
Right.
And so it truly is this, this sports team analogy, I think is the best way and people understand it. All of us have our own role and we truly function as a team.
That's amazing. I was really bad at sports, but I love being on a team. Yeah, very true.
We have a great team here.
Oh, they're unbelievable. They're unreal. I would be nowhere without them. So guys, human kindness is what CommonSpirit Health is all about. I want you to visit their website. Search for hospitals and doctors in your area, including the new sports center. Go to mountain.commonspirit.org. This Healthy Colorado segment is sponsored by CommonSpirit Health. Thanks, Doc. I really appreciate it.
Thank you.
Absolutely.